We are joined by Seema, Adam, and Noelle. Apologies, because forgive us, we are where we are. Noelle's camera isn't working today. I've been there and done that, but we do have her on audio. With that, I'm going to pass it over to the Washington Medical Legal Partnership team. Thank you.
I guess we can go to the next slide. I'm Seema, and I'm one of the social workers at Odessa Brown Children's Clinic, and we're one of the medical partners for our medical legal partnership here in Washington. And I work with Adam and Noelle, who are both, Adam is the attorney who's representing all of our attorneys, and Noelle is our project coordinator for our medical legal partnership. We can go to the next slide. They will definitely introduce themselves, but today we're just talking about how COVID sort of put in we just had a sort of information gap, and we needed to have extra training and capacity building for our staff because we had so many things going on. So that's what we're going to be talking about. We can go to the next slide. I hope I don't talk too fast, but so we're just going to talk about briefly about our patient population, why we had to sort of quickly adapt our trainings to what was happening with our COVID situation here in Washington. And we'll talk about, what we created was the Lunch and Learn. So you're going to hear us talk about Lunch and Learns, and that's the sort of the product that we created. We'll talk about how we evaluated that, and hopefully, like Bethany said, we'll have some time for questions at the end. So we can go to the next slide, and I will try to speak quickly because I feel like there's a lot of information here. So next slide again. Who is the Washington Medical Legal Partnership? So I am, like I said, a social worker at Odessa Brown Children's Clinic, and I was actually here when we started Medical Legal Partnership, back when we had one attorney working with us. And so it was between Odessa Brown, which is a primary care clinic, pediatric clinic, which is a part of Seattle Children's. And then we also have a partner with Harborview Medical Center, which is like our big public hospital here in Seattle, and it's a trauma center, and so it's a really nice partnership. And then our legal partners is Northwest Justice Project, and that's where Adam and all of our other attorneys are working out of. And then I think maybe Adam can speak more to the fact that we have recruit private attorneys to help provide pro bono expertise when we need that as well. So we can go to the next slide. Similar to the pizza pie, this is our way of how we respond for different needs in Seattle. So our base is really capacity building for our providers and our healthcare practitioners. So we're training the medical providers as well as social workers, and I can talk more about what we've been able to do during COVID times, but it's really about being able to identify what the legal needs are, and in that way we can really just like intervene in a different way. I remember when I first started, the attorney told me about the term sanction for families whose federal benefits had been sanctioned. He told me something he taught me was that that's just a legal term, and once a family is in a sanction, we know we can employ one of our legal partners to help us with that, because that's something which I never knew. I would like try to call DSHS and see what I could do to help, which was not really effective. So things like that, just learning different things that help us intervene differently. But then also providing those direct clinical services, and then having more of an advocacy, looking at what are the systems issues that are affecting our families and how we can help on a more broader base. So going through that quickly. So I think we can go to the next slide, and Adam is going to talk to us a little bit about our patient population really briefly.
Yeah, I'll give just a kind of a brief overview of some of our client population. So we've got 5 attorneys based out of Seattle, but our reach is a little bit more than that. As Seema was mentioning, Harborview and Children's both kind of can potentially have patients from all over the state so that we're not limited to just our county. We also do work with some pro bono attorneys if we need to kind of try to reach family law cases. If we're not taking those, we might look for pro bono assistance that way. We can also kind of check in with our other field offices, and we've got those kind of around the state. So Northwest Justice Project has 5 MLP attorneys maybe, but we can rely on some of our other attorneys with expertise in different counties as well to help with that. We're LSC funded, so we're generally, going by those guidelines of under 200% of FPL, but MLP does have some separate funds, so we just have enough cases coming in that our priority is to kind of work with those clients. And then about a quarter of those served are non-English speaking, and about 60% are people of color. I apologize if you can hear, we've got a toddler going to bed right now as well. He's kind of screaming in the background. And then this is just kind of a quick snapshot on what we did in 2020. You can see that there's a big portion of our caseload is not just actual cases we're taking in, but consults as well. And Bethany talked about that. There's kind of, the version we have is we're getting consult requests sent to us, and we respond to those with kind of some in-depth information about the specific issue that they're facing, and then hopefully that kind of is able to assist the patients as well. And then you can see through the numbers that training is just a big portion of what we do as well, and that's where the lunch and learns fall in. So we'll talk more about that as well.
And I can tell you, Adam, that I'm in clinic and we have a lot of screaming children out my door too. So it's just kind of funny. So we can go to the next slide, and I'm just going to talk a little bit about what happened. So like you said, Bethany, it was a year ago that everything sort of started to happen. And I know in my clinic, we really responded quickly. Our leadership helped us sort of make sure that we were keeping our patients and families, as well as our staff, safe in this time. And I was one of the people who's considered a non-essential workforce and was sent home. And I was sent home prior to the time that school was even out. So I was kind of working at home for like a week or so before school got out. And so then the next week, my son was home with me, and we were at home together, and we thought that was going to be for 2 weeks, right? And then that just changed. Obviously, they never went back to school, but as soon as we knew they weren't, the kids weren't going back to school, we knew that, I was no longer non-essential, I guess I could say. So all of a sudden, things became very real very quickly. So while we were reducing volumes in our clinic, so we were trying not to see as many people in the clinic because we were trying to keep as many healthy people home as possible. One thing that we have at Odessa Brown is we have what we call care coordinators, which is similar to sort of the community health worker model, but I'm going to be calling it care coordinators. But we have care coordinators who are sited at the school, who help to provide at different schools in Seattle, so who help to provide sort of that bridge to healthcare with kids who are in the school and their families. So again, when school gets out, they have very strong relationships with so many of those families in those elementary schools, and they understand what is happening. And we jumped, so we used to also have a pop-up food bank at our clinic that we had to stop doing. So what we ended up doing was have the food bank deliver food in bags to us, which is all shelf stable, not nearly the kind of food that we were able to provide when we were having a food bank in our clinic, which had produce and meat and things like that. We're offering things like rice and oats and peanut butter, tuna, canned foods and stuff like that. It was something. It wasn't as robust as what we had been able to offer before, but we had food delivered to us, and then our social workers, our dietitian was involved too, and these 4 care coordinators at the time, we were just like fanning out. We all live in different areas. We were able to, meet a lot of King County, which is the county that we reside in different areas, and providing food, providing diapers and wipes and all of that stuff. So what I learned from that really is that our care coordinators had so much insight about what was actually happening. So when things like when the school district said, we're doing our best to provide laptops for every student and provide Wi-Fi access for every student. What that meant was, you know, they would have each family would get a hotspot or something, you know, similar, and our care coordinators would know right away, like one hotspot for a family of 4 kids is not adequate. And that was information that they just kept bringing back. Another example is the free and reduced lunch program or meal program. Schools were activating and trying to do their best to get meals to families also, and would have, you know, set up sites outside where people could come pick up food, and our care coordinators would say it's really not adequate food either. Like it would be a bagel and a Rice Krispie treat in a bag, and so they were very upset about like the quality of what we were able to provide for our families in those moments. And so they were just sort of highlighting all of those inequities. And we just realized that there was also this gap in what we were able to do or help with. Families were very nervous about, even though the moratoria were set in place, like they knew that they were going to have bills pile up, and how is that going to happen? Or they, you know, like housing managers or landlords were still threatening eviction, even though the laws were in place at that moment. So it's a very scary time for everyone, and we were really, I felt like we were really relying on information from those care coordinators who were out in the community and what they were doing. I think we can go to the next slide, which is, again, quickly, providers just talking about, you know, patients were not interested really in the healthcare aspects. They were more interested in their social determinants of health, of like, I'm really stressed. I lost my job. I lost income. I'm here with these kids all the time, and it's really stressful. You know, while we were trying to ramp up our own telehealth capacity, which we did a really good job at, like a lot of families still weren't able to participate in that because of the computer technology and the Wi-Fi access in their own homes. And the rules just kept changing. So again, even if our patients and families knew what the rules were, if we could give them that information, maybe the housing landlord didn't understand it or didn't make sense of it in the same way. So it's a very hard time for, and we knew also that, you know, our legal partners were not going to be able to contact every family and talk through what their resources are, or how they can respond to the different things that were being thrown at them. Which is why we came to, I guess we can go to the next slide, this idea of these lunch and learns, which was, so I'm part of the advisory board of the NLP here in Washington as well, and we sort of sat together and came up with like, well, what do we need? We need information. As a medical provider, as the people who are out there in the community talking to our families, we just needed as much information as we could get. And so we came, not me, though our attorneys did an amazing job. We came up with subjects that we thought we needed, like obviously evictions, public charge, which really, really affected our immigrants. And we think about, you know, like a moratoria for eviction, but if you're an undocumented citizen and you also feel threatened by your, you know, housing manager, like the layers of those kinds of stresses is really big. So we were still in a different, you know, administration at that time, and we were still very scared about what that meant for those immigrant populations. Then, yes, testing and what it's like to also the food stamps programs that people were getting. Some people were getting a lot of money in their EBT at that time, and some people weren't, and we couldn't understand who and why. Also, all of the education stuff that's been happening. I think I wanted to point one thing out about education. It was like everything this time has been so strange. And then when I would talk to schools about like, hey, this child needs these special services, what are you guys doing? I would come up against people who are super friendly and nice and say like, well, we're doing the best that we can because we've never had to deal with this before, which I can completely understand, but we really don't. What we don't get is that this is going to have a long-term impact on certain students and inequitably, right? And we don't know what the inequities of this gap in education might be for people down the road. So I felt like everybody, while we were trying to navigate all these different systems issues, we were all doing our best, but that might not be enough for some people. So in addition to the education rights, unemployment compensation, what it's like to have to go to court during COVID, and also just having to take leaves of absence based on if you have COVID or not, and what that was like, your Social Security, advocacy, all the different things, all the systems that you have to go through anyway. But then on top of it, it's COVID, right? And how do you navigate those systems? So a lot of that information. Go to the next slide, please. So developed these trainings, which I am going to say were amazing. We did 30 minutes, so from like 12:15 to 12:45, so it was over a lunchtime. And our attorneys like packed that 30 minutes with so much information. You could ask questions. There was a couple times where it was just sort of a more open agenda where it was just a time for people to ask. But again, our schedules as medical providers, which is usually pretty tight, were a little bit loose at this point because we were, like I said, reducing volumes. And so people had a little bit more flexibility in their schedule and were able to just like listen. And it's kind of refreshing to sit and not have anything really expected of you, but just to take in information. I feel like the attorneys did a really nice job of just sort of like giving us information and letting us just like soak in what we could. And then they would, so they'd leave the time for question and answer at the end. But knowing that these also were going to be recorded, so our medical partners were able to access them. And a great thing that I found really helpful was just these sheets. I think Noelle will talk about this, or maybe Adam will talk about these sheets that would come out. Like I could print out, like I knew the topic was happening or happened, and I listened to some information, and then I talked to a family, and I was able to go get the sheet, call up the sheet, and the one pager that had the link that helped me get to help the family, right? To get to the place for unemployment. That was really what needed to happen in that moment. So it was sort of like a really nice way to, you could sit and attend the lunch and learn, then you also could you could watch it again if you needed to, and then you also had a sheet of paper that gave you information of how to handle the thing when you actually came across it in real life. So, and again, I will rave about our attorneys up and down for knowing that how much work it probably took for them to do that. And one other plug I want to say is that it was also a lot, even though I've never met Adam in person. This is the only way I've met him. And I know, like, just to have these faces and our attorneys, know their names. I know I can call upon any of them at this point, and it's like a relationship builder to have that going. Like I know that I trust them and that they're there to provide information for me. So it helped to build that strengthen that relationship as well, even though we were not in person through this whole year. You can go to the next slide. So this is just the same thing that we were talking about with that triangle before the pyramid. Before COVID, we were already doing orientation to our social workers at Seattle Children's and Harborview, and to the medical residents at both of those sites, and teaching about Medicaid in particular, and Division of Developmental Disabilities, and also about autism services, so applied behavioral analysis, as well as public benefits. And then after COVID, or during COVID, I should say, we're doing all of those things, as well as having these extra bi-weekly lunch and learns to help us be up to speed on the topics of COVID at the time. So a lot of work. We can go to the next slide. I think so. Yes, I think Adam is going to talk about what it took to produce all of these things.
Yeah, a little bit going behind and seeing what it takes to get the lunch and learns going. Next slide, please. So the average time can kind of depend on the person and the topic. There's a pretty simple PowerPoint, like Seema was mentioning, the trainings are pretty short. They're 15 minutes of actually, 15 to 25 minutes of like actual presenting, and then time for questions, plenty of time for questions. And so you don't need to prepare a whole lot in a PowerPoint for something like that. But when you start getting into the research on these new laws, that can take some time. So, you know, Kate might, one of my colleagues might even be on this. She can put in the chat what she thinks, how long it might take, but you know, a half day, a couple hours maybe. It depends really. For the first one I gave was an eviction moratorium update. And that took more time because it was the first time I was kind of putting the PowerPoint together, looking at all the laws, thinking what would be helpful for the patients and the providers to have. But when we gave the update a couple months later, you're mostly kind of going back in and filling it up with new dates and maybe a couple new things that have changed, but the bones were there already, so that didn't take nearly as much time. And then if you're going on a completely new topic, one of the things that came up was a stimulus eligibility, which isn't something that we had a lot of experience in. That took us more time, which we didn't really realize going into it. So it's kind of good to kind of plan for more time maybe than you think it would take, because the stimulus eligibility, I just kept going down rabbit holes. Like, what if they asked this? What if they asked this? And then all of a sudden I'm spending way more time than I thought I would on this like 15-minute presentation. But it doesn't have to be like that. That's just, it can be like that sometimes. One really great thing about our MLP is that we have a program coordinator, Noelle, who's hiding her face. Her video's not working. She's on as well, and she does a lot of the heavy lifting for these lunch and learns. And so she kind of partners with the audio, video, and the tech people to make sure that the trainings are going to be able to be recorded and run smoothly. She's helping prepare those flyers and those advertisements to kind of basically push it out and make sure we're getting everyone that we want to. And she's sending that email blast out. One of the things that's nice about these lunch and learns that's a little bit different too is we can have it be kind of geared towards children's, or we can have it geared towards another provider. But for most of these, it's just good for everyone to get that update. So she can send that email blast and she can kind of send it to all of our partners. So Children's, Odessa Brown, and Harborview. And even for some of you out there, you might have other partners outside of who your core MLP is. You could send it to them in a lot of these cases. But for us, that's who we're sending it to. And then I think we can go to the next slide. And then we're kind of, I guess this is just another way of showing what I was saying and how we split up some of the work. And then we're kind of preparing that presentation a couple days before the presentation. We send the PowerPoint to Noelle. If it's me, I give it to her exactly one day before the presentation because that's when she tells me I need to give it to her by. And I'm a procrastinator. And then she sends it to the people who have already said they're going to attend, so they can have that in front of them in case they want it. Next slide, please. And then these are going to be some of the examples kind of going through here on what these look like. So this is kind of the save the date that goes out, and Noelle again is on top of kind of making sure this goes out to everyone. Just gives the very generic, like this is what you're going to have for a lunch and learn. Next slide, please. And then I think this is attached to that same email, but this is like the kind of the one sheet summary that's going to go along with it, that's telling you a little bit more specifically, this is a housing training. Here are some of the bullet points if you're curious, like not just that it's a housing training, but what are some of the specifics you guys are going to get into in case you're trying to decide, and then some of the login information for how to get on that training. Next slide, please. And then Seema was talking about this a little bit. Here's the one sheet kind of summary, the bulletin that Noelle helps create, and we kind of give her some of the information for that kind of summarizes our PowerPoint and our presentation into one sheet that providers can refer to after the training, or if you missed the training, this might give you enough to kind of answer some of your basic questions of what's going on. Next slide, please. And then this bulletin, along with the recording, Seattle Children's has an intranet that people can access this. That's obviously going to be different for other MLPs out there, how people are accessing these materials. But it's kind of got that bulletin, the training, and then sometimes what we include is a little bit more information that we didn't necessarily go over in the training, or maybe we alluded to in the training. And so like one example shows up there is like there was this Q&A that Washington Law Help, which is kind of our centralized database of all of our publications. there was a more in-depth Q&A there. So we linked to that there as well. So that might be something that is helpful for patient families afterwards as well. Next slide. I think Noelle is going to jump in for a bit.
Yes, hello everyone, the invisible partner here. So glad to be talking with all of you. So in good public health and program planning effort, we wouldn't be doing our job if we didn't pause and evaluate after a few months and do some program evaluation. So we wanted to make this really easy on our partners to give us feedback, and we wanted to make sure that they took the time. So we just put together a very brief survey monkey. We let them know up front that it would only take them 2 minutes to complete it, and it would help us improve the usefulness of our lunch and learns. And then we had a great suggestion, which was, we are in the land of Starbucks out here. If we put in an incentive and said, you know, there'll be a drawing for a $10 Starbucks card if you want to put your email address in, maybe we would get more responses. It was very, it was an anonymous survey, but it was, if we'll go to the next slide, it was very interesting to see how many people actually chose to put their name in for the Starbucks card. So we sent the Survey Monkey to 79 individuals who had attended at least one of our lunch and learns in the first 4 months. We started these back in the middle of June. And we do have some what I would call frequent flyers, folks who attend every 2 weeks. So we think that there are more than, you know, this many people attending, because some people gather around a conference table over lunch and only one person may show as being registered for that day. But, you know, there may be, you know, 6 colleagues sitting 6 feet apart around that conference table. We kept the survey open for about 2.5 weeks. It included some Likert scale questions, and then we also had some open-ended questions such as, what are topics you'd like us to cover in the future in a lunch and learn? You know, please give us your input. For a survey, we actually had a pretty good response rate, 36%. We were happy to hear from all of our healthcare partners in our respondents. And my kind of takeaway from this is incentives work. Of the 27 respondents, 25 of them put their name in for a Starbucks card. So next slide, please. This next slide just kind of captures some of our key takeaways. We were really happy to hear that over 90% of our respondents said they became more informed on the topic, and over half of those attending reported that they were better able to answer families' questions, and importantly, know where to refer those families. The bulletins that we prepare afterwards that Adam just showed a slide of, 78% of respondents found these somewhat or very useful, so that was nice to know. And those bulletins are actually pretty easy to put together, because we take the PowerPoint slide that the attorney creates, and then we just kind of put that into a bulletin form, add a few links, and there it is. We also wanted to hear from folks what the frequency should be. So when we started holding our lunch and learns in June, we held them weekly. We switched sometime in the fall to biweekly, so every other week. And then, just as luck would have it, these are held the 2nd and 4th Thursdays of the month. And in November and December, the 4th Thursdays were Thanksgiving and Christmas. So we dropped down to 1 time for those months. And so when we sent this Survey Monkey out in October, we knew the holidays were coming and we were going to drop down to 1. So we were really wanting to know from folks, you know, do you want these just once a month? Do you like having them twice a month? And so we wanted to kind of plan going into the new year in 2021 what the frequency should be. And a third of our respondents said monthly would be great, but overwhelmingly the majority, 60%, said they really like the frequency of having these every 2 weeks. So next slide. Oh,
yeah, and I'll just
turning
mention
it over
too.
to Adam.
Yeah, thanks, Mel. I'll just mention too, it's kind of tough to get feedback in these trainings. We've all been on a lot of trainings online now, and sometimes they're really engaging and there's a lot of back and forth, and a lot of times there's not as much of that, or you're just not in the room and you can't see faces, so it's hard to know or if you're connecting to people, if they are enjoying it, if they are getting something from it. So this is nice to hear that like we need to keep doing what we're doing with some tweaks here and there. I'm going to be mindful that we're about 10 minutes up, but I do want to get through it. I'm going to eat into that a little bit. I've got a couple of things I want to talk about. So I talked about kind of how long some of these take, but I think when we're talking about lunch and learns, maybe in a post-COVID world, or maybe just kind of what that looks like going forward as these laws aren't changing so rapidly right now, I think it still makes sense for us to kind of consider doing these types of trainings going forward. We've talked about this, but one of the ways to kind of be able to, sorry, I lost something popped up on my screen, sorry. One of the things that's nice is that you can kind of consolidate your efficiency and time. And so if we want to give a housing update to our 3 partners, it's a lot quicker and more efficient for us to give it in one 30-minute session rather than trying to go physically to these other locations. And that might take us all day if we tried to do that, or big chunks of several days in a row. And kind of related to that, you can hit all your partners at once. So you can kind of make sure those connections are happening and you're giving them those necessary updates all at once, rather than kind of trying to do that individually. So those are some potential pros, I think, that will come up. And Seema mentioned this, but I haven't actually met any of the partners face to face. I started here during the summer with some previous medical legal partnership experience a while back. But I think that is something to kind of keep in mind with the relationship development. I think there are some pros and cons of it. We have a pretty established MLP where the other attorneys have been working with these partners for quite a while. It's been around for years. And so we're not making those initial relationship developments. I think it would be harder if that's kind of the only way you're going about it. But using it to supplement what you're already doing, I think it has been good. And kind of this changing laws aspect, while things were rapidly happening for a while, and so we wanted to get out in front of it and make sure that those updates were coming quickly. I think there could be a role for these types of things going forward. It could be that there's just kind of updates on current laws that have already been out there that people want to hear about, or just kind of changes that are out there. You know, the housing laws have changed in the past year here, so it might be good to give those updates to people. The guardianship laws are changing here. That might be good to give a quick update to people in a setting that's like this. And while we have this kind of 30-minute block scheduled on people's calendars already, it might be easier to kind of keep rolling with that rather than all of a sudden taking it away and then trying to go back to it. So for now, we're going to try to keep that, I think, and just kind of keep evaluating and seeing how it's working for everyone else. Yeah, I think I kind of blabbered through that really quickly, but I think those are the main points I wanted to get to.
Oh.
Noelle, did you want to give any final takeaways?
I think you've covered pretty much all of these. I think I would just highlight the third bullet there, that these are meant to be a snapshot in time for rapidly changing issues or areas of law that impact under-resourced communities and patient families. So for instance, we've done 4 of these on housing and eviction moratoriums, because that keeps changing. We've done 2 on special education. We've done a couple on public charge. So we are just, as we post these, we just kind of replace them with the most current one, and we definitely have disclaimers on these that these are current as of the date of the lunch and learn. But otherwise, yeah, those are our key takeaways. Thank you so much.
There's one other thing I might just quickly add that I forgot to bring up that is potentially something I would encourage you to kind of utilize. And that's just, you can use experts or like people from different offices for some of these trainings as well. We gave an unemployment training because there was a big unemployment issue with like the benefits happening here, and none of the attorneys on our team had expertise in that. But that was pretty easy to kind of go ask somebody for 30 minutes of their time to come in for a training when they could do it from the comfort of their own home on a video training, rather than like bringing an expert to Seattle Children's. That might be more of an ask and more of a lift for them. And we've been able to utilize that a couple times, and I would encourage that too.
All right. With the permission of the Washington Medical Legal Partnership team, could I, thank you, April, have April read a question that came in, and also came in with a comment, but we wanted to at least pose this question to you all. April, do you want to go ahead and read that question out?
Sure, thanks so much. Michael from the Bay Area Legal Aid sent us a question over asking if you have developed any webinars for healthcare providers or any additional resources that offer their clients or for them to offer to their clients during the pandemic. He highlighted things like how the legal system works, as well as do you know your rights, classes, and things like that.
That hasn't been, anyone can jump in too if they've heard of other things happening, but that hasn't been the focus for us for this particular training. It's been more about connecting with the providers and making that training available in this way. But I could certainly see, I gave you guys kind of one example of how this worked. And that is like with Noelle being a program coordinator and having like really good connections. That doesn't have to be that way. I think there's like a version of this that's just sending out an email update to your partners. There's a version that's just a quick a Zoom meeting that you set up once a month with your partners. That's kind of some updates. And I think another version is one that you brought up that we're not doing, but is like, here's information session for the public, and here's ways to access for that. That's not what we're doing right now.
Okay, great. For the Lunch and Learns, do you have thoughts on the size of the audience? Do you think the more the merrier, or do you think trying to keep it to a smaller, more concise size allows for things to be a lot more substantial?
I'll start answering that, and then I'll let you all jump in. We have shared information on the Lunch and Learns with Children's, our OBCC colleagues, and Harborview. They have in turn given us other folks that they think would really benefit from this. So that's broadened the network, such as our community health centers, our Northwest Justice Project colleagues over in Spokane, and we definitely have kids come to our Children's Hospital in Harborview from that area. So, we have this goes out to about 250 folks that we let know about this. And what we're in the process of doing right now is updating our external MLP website, and we're really looking forward to being able to post some of these bulletins and get that information out to a larger audience through our external website in the future. But right now, I would say on average, we have about maybe 15 to 18 folks sign into Eddie Lunch and Learn, but again, that may be more folks just signing in under one number.
And I would just like to say that I feel like this has really brought in a diversity of like health staff as well. So I know that when I'm watching some of the Lunch and Learns, I can see my colleagues, and some of them are the medical assistants, and some of them are those care coordinators I was talking about. So in the past, I don't think we've really addressed that group of different kinds of providers. I don't know if that makes sense, but so in some ways, I think sometimes our staff are watching to hear about housing moratoria for themselves, right? Like we have so much going on and so much income inequity in our systems of healthcare that I think some of them are doing that, but I also think they are frontline people who see families in the community as well. Like even if you're like a long-term MA medical assistant here, you might see someone in the grocery store that you can like help with this information as well. So I feel like we really have diversified the types of healthcare workers who are getting this information, which I think is awesome. And then just one little offshoot is that our community care coordinators, like I told you, were so invested in what was happening in the community that they were able to actually meet with our medical legal partners as well to talk specifically about what is happening with Wi-Fi access and some other things. And I felt like that was another it's just an offshoot of this, which was that they were able to like really bring their voice for the families that they served and have it, you know, with the attorneys, which I think felt really good for them as well. But I think it's another relationship building thing that we've been able to do through this.
I think that's actually an awesome note to make to wrap us up.